Joining us right now is the medical director and a psychiatrist at South Florida Integrative Medicine. We are talking about what everyone is talking about. That is going back to school, dealing with COVID, dealing with the schools. It is a bit stressful, but it doesn't have to be. So I promise you, Dr. Humphery has 4 great takeaways. Listen closely. We're going to start with number 1, exercise. Go ahead, Dr. Humphery.
Yeah, so exercise is a great way of dealing with stress. And I recommend to all my patients, I actually give it to them as a prescription. When we're talking about exercise, we want to hit certain amounts of exercise. And we're really talking about 20 to 45 minutes, depending on the intensity. If it's HIIT training, high intensity training, we're closer to the 20-minute mark. If it's middle, sort of moderate intensity, we're talking about the 45-minute mark. And it's because the brain has to hit this milestone of about 200 to 300 active kilocalories burned. When it does that, it secretes a compound, a neurotransmitter called BDNF, which is brain-derived neurotrophic factor. And it basically means like miracle grow for your brain. So it allows your brain to deal with stress better, to problem solve better. And again, it has to be 200 to 300 kilocalories of active calories burned. Another compound that secretes, that helps the brain secrete BDNF is actually omega-3, which then gets us to talking about a little bit about nutrition, right? So in terms of nutrition, omega-3 is one of my all-time favorites. It helps actually with the exercise as well, because it helps act as an anti-inflammatory. So it helps with recovery after exercise. But in terms of the brain, it helps the brain secrete BDNF, and it helps the brain also problem solve better. In terms of omega-3, we're talking about at least 400 to 600 milligrams per day.
So how much fish would you have to eat to get?
You would have to eat a whole bunch of servings. So just, I think too many for comfort. It probably would have to be over 10 servings per week. So it's just easier to do the omega-3 supplement for kids. Nowadays, there's gummies. The problem with the gummies is that sometimes they're not strong enough. So you have to find a gummy that has a lot of omega-3, that it's very concentrated. My other supplement that I like for kids is actually magnesium. So magnesium is another good one. You want to stick to the 100 to 400 milligrams of magnesium per day, depending on the type of magnesium, because they can come in glycinate, citrate. Now, magnesium is interesting because if you overdo it, you will know that you've overdone it, because you will have loose stools, right? Because it's a laxative.
Yeah, so we don't need any of that. We're stressed out enough with everything going on.
We don't want that.
A solid 30 minutes of exercise, hardcore exercise. We have nutrition, omega-3, and magnesium. And the last 2 on your list were mindfulness and breathing. What are our takeaways there?
Yeah, so in terms of mindfulness is the practice of getting the brain trained to be in the present moment. So to pay attention to the one thing. So for kids and for adults who haven't been practicing mindfulness or haven't been practicing yoga, a good way to start is to use apps, because now everything is through apps. So 2 of my favorite apps are the Calm app. So the Calm app and the Headspace app. And they have guided meditation, they have some games, they also have stories, especially for kids, like sort of bedtime stories. Those are great ways of starting to practice paying attention to your breathing or paying attention to the voice, and training the voice on the app, and training the brain to be able to stay focused on the present moment. And that actually then takes us to breathing, which is just breathing techniques that kids or adults could use at any time to be able to sort of center, to focus, to calm down. And they are all based on the principle of breathing from the diaphragm, because that's very relaxing. And so in terms of diaphragm breathing, it's a very simple technique. You want to inhale, say pause after the inhale. So say 4 seconds of inhale, pause, and then you want to take double the amount of time to exhale than you took for the inhale portion. So it could be 4 seconds, pause, exhale, but slowly.
Makes sense. All right. I love it. I love our 4 takeaways. on breathing, on exercise, on nutrition, and on mindfulness. Dr. Humphery, you nailed it. I think it's going to help everybody through the year. So thank you so much for your time today. South Florida Integrative Medicine Medical Director. Thank you so much.
Take care. Bye.